Hello friends, welcome to my new video. So today in this video, I will discuss with you all about a very important topic that you all should know. So I'm telling about third nervous system. So previously, I uploaded video on Horner syndrome. So today, it's time to discuss about third nervous system. So here in this introduction slide, you can see that this person is having, it's quite looking like in the primary position, the right eye is quite in an extreme manner, right? We are having in exotropia, and also when he moves his eyes to dextroversion, then both eyes are moving to that direction. But when he tries to move the eye in levoversion, then this eye is not moving to nasal side, but this eye is moving. That means your medial rectus muscle is not working, as well as when he wants to look for upside, then this eye is not looking up and also not looking in down manner. So, what issue happened in this patient that he is not able to move his eyes properly? That we will discuss in today's presentation. Okay, so let's continue. So here, first of all, uh, what is third nerve pulses? So it is the damage of the third cranial nerve that leads to multiple signs in the eye, leading to ptosis, restriction of the eye movement, diplopia. Why diplopia? Because of the restriction of the eye movement. So it leads to strabismus, and also the prevalence of third nerve pulse in India is about 38.88%. Right. So here this presentation on third nerve pulse. So here I will explain you all about the third nerve pulse, exploring its pathway, causes, and diagnostic approaches as well. So here, as I told you earlier, and also again telling you that it is the damage to the third cranial nerve, that is oculomotor nerve, right? So if damage happens to oculomotor nerve pathway, that leads to multiple signs that you will see in form of different signs that I will discuss in the later slide. So here, throughout this presentation, we will discuss the detailed pathway of the oculomotor nerve, highlighting the role in eye function, also common causes of third nerve palsy, including vascular condition, trauma, or inflammatory disorders that we will discuss. And also we will go through different kind of diagnostic testing that we do for detecting the third nerve palsy. So be sure to stay tuned and watch the entire video as we explore each aspect in detail. So whether you are a healthcare professional, student, or someone interested in understanding neurological condition, this presentation aims to provide a valuable insight into third nerve pulses. Okay, so here, this is the oculomotor nerve pathway. Okay, so it actually get originate in the oculomotor nucleus and adrenal vesicle nucleus. So that thing I want to discuss with you all. This is the oculomotor nerve pathway. So it is having two different pathways, right? One is general oculomotor nerve pathway, another is parasympathetic pathway. So here, the oculomotor nerve is very much crucial for controlling the several muscles responsible for eye movement and function. So here, first of all, it originates in the oculomotor nucleus, which is present in the midbrain, and also from the laryngeal vesicle nucleus. Then these nuclei coordinate the movement of the eye and the pupillary responses. So from exiting the midbrain, the nerve actually passes through the interpendular fossa, which is located in between the cerebral peduncle. Then it travels towards through subarachnoid space, navigating between major blood vessels like posterior cerebral artery or superior cerebral artery. Then piercing from the dura mater, the nerve then enter the cavernous sinus and venous structure located on the lateral side of the sella turcica of the sphenoid bone. So here within the cavernous sinus, the oculomotor nerve runs alongside the important cranial nerve and vascular structures like trigeminal nerve. It go along with that. Then leaving the cavernous sinus, the nerve enters the orbit through the superior orbital fissure, which is a narrow opening in the bony orbit. Then it divides into two parts, right? Superior division and inferior division. So in the orbit, the oculomotor nerve, which divided into superior part. So the superior part actually innervate the LPS muscle and or which is responsible for elevating the eyelid. Also, it is innervating the superior rectus muscle, which moves the eye upward. So the superior division controlling two muscles, LPS muscle and superior rectus muscle. And if I tell about the inferior division, so the inferior division of the oculomotor nerve innervates several muscles like the medial rectus muscle, which move the eye inward, inferior rectus muscle, which move the eye downward, and inferior oblique muscle, which help in torsional movement of the eye. So all these things are because of the oculomotor nerve pathway. But as I told you earlier, that there is a parasympathetic pathway also there. So the parasympathetic pathway of the oculomotor nerve control the important functions of the eye. I'm telling about pupil and lens. So here, it is journey. It also starts from the midbrain edge visual nucleus, where the special nerve gets originate. Then this nerve fiber travel from a oculomotor nerve, which also control the eye movement. Then passing through the cavernous sinus, the cavity located behind the eye. So the nerve make its way towards the orbit. It enters the orbit through a small opening called superior orbital fissure. Then within the orbit, the nerve divides into branches, and the parasympathetic fiber travel the inferior within the inferior division of the oculomotor nerve. Right. So this fibers then sinus at the junction called ciliary ganglion, which is near to the back of the eye. And after that, from there, the postganglionic fiber extends to two important muscles, that is sphincter muscle and ciliary muscle. So sphincter muscle actually helps the pupil to get constrict, right? And ciliary muscle help in accommodation. So from this small discussion, what we got the idea that oculomotor nerve is playing a very much major role in controlling the extraocular movement of the eye as well as it control the constriction of the pupil and accommodation. So if any damage happen to its pathway, then it leads to several conditions. Okay, that we will discuss in the later step. So first of all, let's discuss about the causes of third nerve pulses. Okay, so here there are various causes because of that it happened. So first of all, uh, one of the most significant vascular causes of third nerve palsy is diabetes mellitus. So diabetes can damage the small blood vessels that supply the oculomotor nerve flow, and this can result in nerve dysfunction. And patients with diabetes are higher risk of developing the third nerve palsy, and managing blood sugar level is crucial. Another is like because of the trauma. Now, if I tell about the trauma, then specifically to the head trauma. Head traumas are the most common and traumatic cause of third nerve palsy. So, when a person experiences significant blow to the head, it can lead to direct damage to the oculomotor nerve that can be compressed or torn due to the impact of swelling following the injury. So this can severely impair the movement of the eye as well as several functions because of the third nerve pulses, okay, because of the trauma. Then, if I tell about the compressive lesion, then moving on this topic. So here, tumors play a significant role. Tumors, particularly those located in or around the midbrain or along the pathway of the oculomotor nerve, can exert pressure on the nerve. So this compression can disrupt the nerve ability to function properly. So tumors may require surgical intervention to relieve the pressure and to restore the nerve function. So also, if I tell about the infectious causes, then the orbital cellulitis is the key example. So orbital cellulitis is an infection of the tissue surrounding the eye. So it can spread or to affect the oculomotor nerve. So this infection can cause inflammation, swelling, leading to nerve compression, subsequent third nerve palsy. From a very much immediate treatment with antibiotic is very much important. Otherwise, restoration of the condition is very much difficult in this kind of conditions as well. So if I tell about the inflammatory or autoimmune condition. Here, the key example is multiple sclerosis. So, multiple sclerosis is a major factor. Okay, so it is a chronic disease that affects the central nervous system, leading to demyelination of nerve, including the oculomotor nerve. So, this demyelination disrupt the transmission of the nerve signal, causing symptoms such as third palsy. And so, this is why the managing of multiple sclerosis with appropriate medication can help to mitigate the symptoms. So, if you see in this two neuron, then this is a healthy neuron where the myelination is very much good manner. But you can see here the demyelination of the nerve. Another important information that I want to give you that the nerve fiber that is present in the retina are non-myelinated, but once they cross the lamina fibrosa area, they become myelinated. Okay, and miscellaneous cause like here it is because of any drug type reaction and something else. If I tell about the congenital causes, so birth trauma can lead to congenital third pulse. So during the difficult delivery, the oculomotor nerve can be injured due to excessive pressure or improper handling. So this can result in immediate or delayed onset of this third pulse in newborn, and early diagnosis intervention is very much important in this kind of cases. Okay. So here, first of all, we will discuss on the sign and symptoms of third pulses. So these are the signs of third pulses. So here, the most common symptom uh, that patient experience is double vision. So symptoms mean what the patient will tell, and signs mean what you will see, right? So the patient will complain you about the double vision, which is medically known as diplopia. So this happens because the eye are not aligned properly. Uh, so here, which causes the brain to receive two different images, leading to double vision. So imagine trying to read or even walk straight when you are seeing two overlapping images. So it will be quite disorienting and uncomfortable for you also, right? So another noticeable symptom is a droopy eye. So here you can see that droppy eyelid is also known as ptosis. Why? Because in the pathway, I already told you that the parasympathetic pathway of oculomotor nerve, which is coming along the inferior division, then it innervates the levator valvular superioris muscle. So in Horner syndrome, what you see that because of the damage to the sympathetic nerve, it leads to uh, not working properly of the molar muscle. But molar muscle is not the primary muscle to elevate the eyelid. LPS muscle is the primary muscle. So in the Horner syndrome, you have seen that the eyelid process is quite very much minimal because molar muscle is not the primary muscle. But here, the LPS muscle is getting affected. So because of that, it leads to significant ptosis. Okay. So here, if the parasympathetic fibers only get affected and the other portion is normal, then you will only see ptosis with dilated pupil and difficulty to accommodate. Why? Because of the parasympathetic fiber paralysis. Okay. So this is why a ptosis actually there. So if this condition lead to very long period of time, then it also can lead to stimulus deprivation type of amblyopia. Okay. So here in this condition also you can see that this is the primary condition where it's quite not that much clearly evident that the patient what is the condition. But if we tell the patient to see in the Leo version, then both eye are moving to this side. Okay. So here, as you know that medial rectus muscle is innervated by oculomotor nerve, but lateral rectus muscle is innervated by cranial nerve, right? So here, lateral rectus muscle is very much healthy. So that is why the eye is moving to an abduction manner. But when the patient is told to see in the dextroversion, where the medial rectus muscle should work, it is not working because of the turn pulses. But here in this patient, you can see that ptosis is not significant and the pupil size is normal. That means the parasympathetic fibers are okay and the damage is happened to other section of the oculomotor nerve. So this is why the pupil is not dilated and socket is also not there, but the restriction of eye movement is there. Okay. So the restriction of eye movement superior, inferior, right? All these are there, right? So this is because of the third nerve pulsing. And also you can see that here in ptosis kind of cases, the pupil is quite dilated manner. Okay. Ptosis means full ptosis because LTS muscle is not working, so it is leading to full ptosis. So another term that is quite commonly used is ophthalmoplegia, means restriction of the eye movement. But it is not total ophthalmoplegia because superior oblique muscle and lateral rectus muscle are innervated by other nerve, like superior oblique muscle innervated by the fourth cranial nerve and lateral rectus is innervated by the sixth cranial nerve. So they are not affected. So you cannot call it is a case of total ophthalmoplegia. It can be an ophthalmoplegia. That means restriction of the eye movement is there, right? So signs like you will see strabismus, ptosis, ophthalmoplegia, and pupil involvement. If pupil involvement, it can be pupil involvement or pupil sparing. Okay, so you need to examine it properly. Okay, so that is why uh, you also can see the presence of RAPD or all such things, for instance, right? So how? Now let's move to diagnosis. Diagnosing the third nerve palsy involves a thorough examination process to understand the natural and potential causes of the condition. So we start with a detailed discussion to gather information about when the symptoms begin and how they have progressed. And this include asking about the associated symptoms like headache, eye pain, change in vision that could provide clues to the underlying cause. So here, during the physical examination, we focus on assessing the movement of the eye. So here we observe how well the eyes can move in different directions and check for any dropping of the eyelid. That is also known as ptosis that I showed you earlier. So these observations help us to understand the extent of nerve involvement and guide further diagnostic steps that we can take. So the critical part of examination is assessing the pupil. So you should see the RAPD first. And taking RAPD will help you if there are differences in the pupil size, then one of your pupil does not react to the light properly, which could indicate nerve damage can be there, right? So you know this very well how to check the RAPD. Or I also made one video earlier. You can see that video also. So additionally, we perform the swinging flashlight that is also known as RAPD. And after that, imaging testing are also very much important, right? That MRI, CT scan to are very much essential to visualize the structure of the brain and nerve itself. So this scans help us to identify any structural abnormality like tumor, aneurysm, or stroke that may be compressing or affecting the third cranial nerve. And also blood tests are also important part of diagnostic process. So this test helps us to rule out the systemic conditions such as diabetes or infection so that could contribute to the nerve involvement. So depending on the finding from this initial test, additional evaluations like a tensilon test for myasthenia gravis or cerebrospinal fluid analysis may be necessary for further refinement and the diagnosis and for moving to the management section. So here the optometry. So I have segregated the management in two parts. One is optometry management, another is ophthalmology management. So optometry management. So optometrists play a very much vital role in managing third nerve palsy by focusing on improving the visual comfort and functions through non-surgical intervention. So here, first of all, prism glasses. So these specialized glasses are designed to align the image from both eyes. If the patient is complaining of double vision, so by placing the prism, uh, uh, so it can reduce the double vision by redirecting the light into a single focusing point. So this adjustment can significantly enhance the visual clarity and reduce discomfort caused by misalignment of the eye. After that, you can also try for occlusion therapy. If the patient double vision is not going, then until the treatment process is ink, then you can patch one eye so that the patient should get off from the double vision. And another thing like vision rehabilitation is also plays a very much vital role. If because of the ptosis or any kind of condition that vision is not improving, then after getting treatment properly, then you can also give the patient vision rehabilitation or vision therapy something. Okay. This is the ophthalmology management. So ophthalmologists employ a comprehensive approach to managing this third palsy, focusing on both medical and surgical intervention to address the underlying cause and optimize visual function. So here the medical treatment takes steroids. So if inflammation is suspected as the cause, so ophthalmologists may prescribe steroids to reduce the swelling and elevate pressure on the affected nerve. So this treatment aims to mitigate the symptoms and facilitate nerve recovery as well. Antibiotics also can be used here. So in case where an infection triggers sudden pulses, so appropriate antibiotic or antiviral medication are administered to eliminate the infection in infectious agent and prevent the further nerve damage. Surgical intervention is also very much important, like strabismus surgery for patients experiencing persistent misalignment of the eye with strabismus. Ophthalmologists perform surgical procedures to reposition the affected muscles. So by restoring the proper alignment, so this surgery aims to elevate diplopia and improve the visual coordination. And also ptosis surgery, like if ptosis, that is the dropping of the upper eyelid, significantly impair the vision or affected aesthetic appearance, so ophthalmologists may recommend some surgical correction of the ptosis. So ptosis surgery lifts the droppy eyelid to restore the normal eyelid function and enhance the visual field as well. Another is like management of the underlying cause. So like aneurysm treatment. If cases in cases where the nerve pulse result from an aneurysm compressing the nerve, so ophthalmologists collaborate with a neurosurgeon to address the aneurysm. And treatment options may include surgical clipping or endovascular coiling to elevate the nerve compression and restore nerve functions. And also, if it is because of the tumor, then removal of the tumor surgically is also advised. Stroke management, like if the third nerve pulse is a consequence of a stroke, then ophthalmologists coordinate with a neurologist to manage stroke-related complications and support neurological recovery of the eye. So that's all, sir. Thanks for listening. Please don't forget to like my video, subscribe to my channel. I hope this video helped you a lot in understanding more about third nerve pulses. Thank you so much for your time.